California is known for its earthquakes, and California Senator Adam Schiff is advocating to get FEMA funds reinstated. I'm Eric J. Docker, your Bakersfield neighborhood reporter. These funds will help California residents in case of natural disasters. Without these funds, thousands of residents are at risk of losing everything.
This hospital will most likely close or not be able to treat patients ongoing beyond 2030.
Kern Valley Hospital, along with other medical facilities, have been affected by FEMA due to its taking away of $33 million in critical funds for California retrofitting. This will affect residents whose homes or businesses need to be retrofitted in case of an earthquake, leaving them at risk of losing everything.
Well, this is funding that Californians would use to harden their homes, their buildings against earthquakes. What we've seen in a number of earthquakes in California, like the Northridge earthquake, is a lot of these soft-sided apartment buildings, particularly those that have carports, that if they don't have reinforced structure, those carports collapse and then the apartments above them collapse and lots of people get killed.
Facilities like the Kern Valley Hospital have applied twice for FEMA funding so they will be able to get their building up to code. Both times they were approved but never received the funds.
The cost cutting that had been going on at the White House and so forth. And so that was critical for us. You know, prior we had gone through multiple attempts to try and get funding through our community, either through taxes, increased taxes, or through other means and so forth, and just could not get that done.
If the funding is restored, this will allow residents and property owners to prepare themselves for the unknown. According to the California Hospital Association, all hospitals in California need to be retrofitted by 2030. If Kern Valley Hospital isn't retrofitted by then, it will be forced to close, which will affect residents in that community.
We're lucky and we have approved building plans already from the state. We have building permits that have been issued by the county to go ahead and get started, so we're literally considered shovel ready. And that was one of the things that FEMA was very impressed with and why they had approved us on that grant.
And we're going to try to make sure that we continue to provide vital help to serve our constituents. In Kern County, I have no doubt that Kern County is very dependent on Medicaid funding for the health care that is provided through the county to a lot of folks in the county who really need that health care.
The hospital needs to get the funding before April 2026. If not, their plans and building permits will expire, which will result in a huge expense for the facility.
And that would be traumatic, you know, again, for this community, being that we're the only hospital in this community and so forth. If you got a major earthquake that comes through, that canyon's going to be impacted, and the likelihood of our being able to get patients out of here is going to be dramatically compromised.
California is at risk of losing $9 billion per year due to earthquake damage. Residents here fear, without the support of the federal government, homes and lives will be lost. For 23 ABC, I'm Eric J. Docker.